All right, thank you, Chris. You know, prostate cancer is 100% survivable if detected early. And that's why September is Prostate Cancer Awareness Month. It's a chance to let men know the importance of early screening because 1 in 6 will be diagnosed with the disease in their lifetime. So joining me this morning is Dr. Zucel Solc from WellSpring Oncology. Thank you so much for being here with us this morning. And I know we went over symptoms and what the prostate is and what it does, but for folks who missed it, can you just give us the symptoms of if something is wrong?
Well, usually the majority of patients will be detected with what we call a PSA. However, very few will present with symptoms, and symptoms of frequency urination, getting up at night, symptoms that will reflect an enlarged prostate, and then some of them on digital rectal examination, the doctor will find a lump in the prostate, and that may lead to biopsies and eventually to the diagnosis of cancer.
What is a PSA?
A PSA is a blood test. It's called a prostatic specific antigen, and it's produced by the cells, and they're released in the blood. And there is a normal level, usually from 0 to 4. Over 4, you should be alerted.
And for, say, a man is diagnosed and he has prostate cancer, and we say that it is 100% survivable if it's detected early. What are some of the treatment options?
Basically, there are 3 modalities that are approved, i.e. surgery, which will be the removal of the prostate and the removal of the pelvic lymph nodes. The second will be radiation, either in the form of external beam. There are 2 modalities now. The current one is radiation delivered by IMRT, and radioactive seeds is the other one that you insert in the prostate, these radioactive pellets, and then deliver the radiation. And then you have modalities that are up and coming, i.e. cyberknife, cryosurgery in the good hands can give you good results. But the ones that are basically approved are the ones I mentioned.
Sure. And do you think what stops a lot of men from going to have their prostate checked and getting the treatment that they need is the fear of impotency?
Right, that's correct. Unfortunately, no matter what you do, there is always a fear of impotency. We have to take the time, spend time with the patient and the family, educate them. There are always alternatives and ways to correct that too.
Yeah, so the bottom line is they just have to get checked.
That's
and
correct.
Just make sure that they are healthy. Dr. Zucel Solc from WellSpring Oncology, thank you so much for your time this morning. Pleasure meeting you. And of course, we'll put all of this information online. If you have any questions about prostate cancer, you can ask them on our website, tampabase10.com.